Hi guys, it's JennStarr again. Today I would like to talk to you about HIV prevention. The three things that I think are most important to consider when thinking about prevention are HIV testing, protection, and treatment. So first of all, I think that HIV testing is perhaps the most important strategy overall for the prevention of HIV. Everyone should get tested at least once, and those that are at higher risk should be tested on a regular basis. Higher risk individuals include those that have multiple sex partners, IV drug users, those who work around blood on a regular basis, like nurses and phlebotomists, and anybody else who thinks that they may have been exposed. It's recommended that all pregnant women be tested to reduce the risk of mother-to-child transmission. Also, if somebody engages in a new sexual relationship, then both partners should also be tested. Also, on top of HIV testing, people should also be tested for other STDs, as having an STD increases the chance of an initial exposure turning into an HIV infection. HIV infection is often comorbid with other STDs. So the second thing I'd like to talk to you about is protection. So HIV is spread only in certain bodily fluids by an HIV positive person. These bodily fluids include blood, seminal fluid or semen, pre-seminal fluid, rectal fluid, vaginal fluid, and breast milk. In the US, most HIV infections are acquired through unprotected sex and IV drug use. So, to reduce the risk of HIV infection, condoms should be used anytime that vaginal or anal sex occurs. And for oral sex, there's other barrier protections like dental dams that can be used. If a person is an IV drug user, then they should be using disposable and sterile equipment, and they absolutely should never share any of that equipment with another person. If a person is HIV negative, but they feel that they are at high risk for for acquiring the infection, like if they're a sex worker or they're in a relationship with an HIV positive person, then they can talk to their healthcare provider about getting a pre-exposure prophylaxis, also known as PrEP. This is very effective at reducing the risk of HIV transmission. If someone thinks that they might have been exposed to HIV, they can go to the emergency room or talk to their healthcare provider about post-exposure prophylaxis, or PEP. This is also very effective if used within the right time frame. The ideal time frame after exposure is 48 hours. It can also be used up to it can actually be used up to 72 hours. Beyond that 72-hour point, it loses its effectiveness. But if a person uses that within the 72-hour time frame, then it reduces their risk of getting HIV by like 99%. It's extremely effective. Also, if a pregnant woman is HIV positive, then she needs to be taking her antiretroviral therapy or treatment every single day, exactly as intended. If she does so, then she can also greatly reduce the risk of transmitting the HIV virus to her baby. Finally, I'd like to talk to you guys about treatment. So treatment with antiretroviral therapy is highly effective. And if you're HIV positive, then it's effective at controlling the disease, but it's also very, very effective at reducing the risk of transmission. It can actually reduce the risk of transmission up to 96%. It's huge. So beyond the obvious advantages of taking antiretroviral treatment, as you're supposed to, like a survival, extended lifespan, improved quality of life, you can also protect those that you love and those that you are in a relationship with. So taking your antiretroviral treatment is extremely important and plays an important role in the prevention of HIV. So I want to thank you guys for watching, and I hope you guys have a good weekend, and I will see you next week. Thank you.